Hey everyone, my name is Timothy Hanschel. I had the pleasure of researching osteoarthritis for my final project. I've been a vet assistant for 3 years now, and I thought this was a pretty interesting topic to look at. There's different medications for dogs and cats that have osteoarthritis. It's pretty common. I see it a lot at the hospital, so I wanted to look into it. So let's start off. So, what is osteoarthritis, and how is it caused, and what are its effects? So, osteoarthritis can be characterized by inflammation of the joint and the wearing down of cartilage that cushions the bone. So, osteo is the bone, and then itis is inflammation, and then osteoarthritis is pretty much the inflammation of the cartilage that holds the bone. So why is this a problem? So the problem is that we have cartilage in between our bones to cushion the bones, cushion the joints. If this deteriorates over time, it causes lots of pain, and two bones rubbing together is not comfortable or okay. Osteoarthritis can cause pain, swelling, and stiffness for the patient. There are different levels of severity in dogs and cats. Usually, dogs and cats will have osteoarthritis when they get older, just as humans do. It's pretty common, but it's very uncommon for dogs and cats to get osteoarthritis from a young age, unless they have an injury or pre-existing condition. I know a lot of Labrador Retrievers, German Shepherds, and other large dogs that are pretty active, like mine, have osteoarthritis just because they have a pre-existing condition, or they're very active. So we're going to go over four medications for osteoarthritis, and two of them are very new. And they have come out in the last 2 or 3 years. So the first one is called Librela, or Vetmab. That's the actual name, but the common name is Librela. Librela is a pharmaceutical drug that helps dogs with osteoarthritis. The acting agent in Librela is a monoclonal antibody. This type of protein causes pain reduction by acting on a nerve growth factor. This nerve growth factor, interestingly enough, attaches to receptors on nerve cells, and the dog cannot feel the pain. And the FDA approved this drug to be used starting May of 2023, so last year. It's very new. I know my vet clinic just is starting to use it. And this is only for dogs. So then there's another medication called Solensia. Solensia is only for cats. So it's pretty much the same thing as Librela, just for cats. And it uses a different monoclonal antibody called Vetmab. It's another monoclonal antibody, and it works the same exact way. It acts on the nerve growth factor and inhibits pain. And this was approved by the FDA in January of 2022. So a little faster. It was approved than Librela. So how is Librela and Solensia offered? It's offered via injection subcutaneously under the skin. Other drawbacks to Librela and Solensia. So some patients have experienced very quick and positive results, but they're not long lasting. So in my experience at the vet clinic, in my case studies, in my experience, the veterinarians that I work with when I'm in the room are usually taking patients off of Librela and Solensia when they have very quick effects, and then they take them off if it's not working for them, and they put them on a different drug. So It doesn't work for every animal. It's case by case, but it is effective very very quickly. So that is a positive, but it's also a negative that it doesn't last as long as it could. So what other medications help osteoarthritis? So there's two other medications that help patients with osteoarthritis. This first one is called Rimadyl or carprofen. This is pretty commonly known for osteoarthritis, and it's an anti-inflammatory. So, right, we talked about how osteoarthritis, that itis part of the word arthritis, right, is inflammation. So this is a anti-inflammatory. So it prevents that inflammatory response. Carprofen is used for soreness, pain, and inflammation. It's not recommended for patients that have kidney and liver problems. So before the veterinarians prescribe carprofen or any of these medications, they look for a CBC and sometimes a chemistry too. So CBC chemistry looks at total blood count and total chemistry panel. So it's going to look at if any of the biomolecules are not in the right levels. So if there's liver and kidney values that come back that are high or really low, carprofen is not a great option. And then we can switch over to something else. So how carprofen works, it doesn't work on nerves, it works on enzymes and inhibits an enzyme. The other one is Galliprant. Galliprant is used for swelling and pain for osteoarthritis, and it's another option. Thank you so much for listening, and I hope you learned something about osteoarthritis today.